it is a great privilege for me to be talking to you today about balance problems and hearing problems in senior citizens. So now this is actually quite a large problem because over 30% of people aged over 65 years have problems of unsteadiness or dizziness. And it has been seen that over the age of 65, 1/3 of the population has problems with hearing.
Good morning, sir. How are you, sir?
Which increases to almost 50% over the age of 75. Now, the problem is that as there is often no sudden change, people may not be aware of the problem until it gets severe enough to cause a problem in communication or a problem in mobility. So, why am I talking about this? I am an ENT surgeon and I'm specialized in problems of the inner ear. The inner ear has two main functions. One is hearing, which is taken care of by the cochlea, and the other part, the balance organ, or what we call the vestibular labyrinth, controls the balance control of the body. Now, why do we have two sense organs? Starting with the simple example of the eyes, if you actually close one eye, you'll see that your field of vision is hampered maybe by 1/3, not half. But the more important part is that the two eyes give us the depth of vision. You're able to understand distances and three dimensions. Similarly, we have two hearing organs to understand the direction of sound in a suppose you're talking to a group of people. From where is the sound coming? Who is speaking? For that, you need both your ears. Similarly, we have these two balance organs in the ear to be able to control our balance in a three-dimensional space and also to be able to focus during head movement. So, the balance reflex is actually the fastest reflex of the body with a speed of around 7 milliseconds. And you'll be able to appreciate the difference when we compare this with the visual reflex, which has a speed of almost 10 times longer, over 75 milliseconds. I'd like you to do a very simple experiment. Take your thumb and put it in front of your stretching out your arm and just look at your thumb. And now I want you to just move your thumb side to side. And you'll see that after a certain speed, the tip of your thumb gets blurred. This is what the visual system is able to control. Now, just doing a slight change in that, again, taking my thumb in front of, with the stretched out arm, and now I move my head. And you'll see, no matter how fast I move my head, the tip of my thumb is still in focus. This is how the balance system controls your body. Today, I'd like to talk about neuroequilibrium, which we have set up, Rajneesh, my husband, and I. We have set up the world's largest chain of vertigo and dizziness clinics. And we have over 170 installations in 50 cities. And this includes the premier institutes like AIIMS Delhi, AIIMS Raipur, along with multi-speciality corporate hospitals like Apollo, Fortis, Narayana, etc., and single speciality ENT and neurology centers. We have a few centers outside India and are now looking to spread to the Middle East, Europe, and Southeast Asia. To evaluate a person with balance problems, we have various equipment which are used to do a comprehensive, thorough evaluation of the system. And these are just some of the diseases which cause vertigo and dizziness, which we are able to diagnose with our tests. Now, the balance is affected in 60% cases by inner ear problems. But especially in elder patients, it can be multifactorial. And we must be able to also diagnose things like stroke, cognitive decline, and other disorders which may be coexisting and which also need to be controlled. Polypharmacy, that means having to take several kinds of medicines for different disorders, is more common with increasing age. So a patient may have things like diabetes, with hypertension, with high cholesterol, or osteoporosis, for which you have to take different kinds of medicines for different conditions. But given together, they can have different effects on the body. A very important thing to check out for people over 60 is fluctuating blood pressure. Now, in normal conditions, whether you do it yourself or your doctor or nursing staff, they normally check the blood pressure either in the sitting or lying down position. But what we really need to do in people with unsteadiness is check the BP in the lying down position and then again check it when the patient stands up after 1 minute of standing up. Some people will see that the BP suddenly falls, and this is called orthostatic hypotension. These patients are at a higher risk of unsteadiness and falls on change of position because the brain does not receive enough blood supply on that change of posture where the BP falls down. Diabetes is a condition which can affect the balance control in different ways, right from retinopathy, in which the vision is affected, to diabetic neuropathy, where the nerves they have a decreased sensitivity, diabetic foot, and an increased risk of stroke. So we need to be able to make sure that diabetes is controlled as far as possible. Now, vertigo, what people say, chakkar. It can present in different ways like unsteadiness or fear of fall. But the most important thing is that the patients feel that suddenly they have aged because of slowing down of movement, the inability to multitask. They may have had a fall or are now scared of falling, which results in a loss of confidence, and this may ultimately cause a social withdrawal. I'd like to talk about some of the common causes of vertigo. BPPV is one of the most common causes in which a crystal from one part of the inner ear gets dislodged into the fluid of the ear. And these patients will complain of a dizziness or a spinning on things like getting up from bed, turning in bed, bending down, etc. And the vertigo or the chakkar typically lasts for seconds to less than a minute. Now, it is for us to understand where that crystal is, and we do different kinds of exercises. Here in the inner ear model, you can see this yellow ball which is stuck in the fluid. By taking our patients to different kinds of exercises, we are under the guidance of the camera, we move those crystals out of the what we call the semicircular canal where the crystal is trapped. And by a series of movements, we are able to bring that crystal out of the wrong position out of the displaced position and set it back in the correct position. These crystals can be stuck in different parts of the inner ear, and it's important to recognize where it is to be able to do the correct maneuver for that particular patient. So here you can see the yellow crystal being displaced out of the canal and going back to the correct position. These patients often feel better instantly. And this condition, BPPV, increases with increasing age. Conditions cause weakness in the balance nerves. The requirement of the patient in small, steady steps to be able to give that person the best recovery. This clinical practice guidelines for vestibular rehabilitation says that people with giddiness and dizziness can get worse if they are prescribed exercises which are not appropriate for their condition. So it's very necessary for us to recognize the severity of the problem and the status of the patient for us to decide which exercise modules would be best for that particular person. The vestibular rehab is given to patients in two forms: in clinic rehab under the guidance of the physiotherapist, which is customized according to the test results. And for patients who cannot come to the clinic, we also do online rehab through our app, where again the physiotherapist guides the particular person according to the exercises required on 1 to 2 times in a week. Often patients of unsteadiness require counseling therapies. This is because there is a vicious cycle between what your thoughts come. These are often automatic thoughts. It is not something you can control, but that results in a change in feelings, and this modifies behavior. So, through cognitive behavioral therapy, we are able to help the patients also become more positive, to curtail feelings of anxiety or depression, which they may have associated with these conditions. We also work on lifestyle modification and cognitive stimulation. Let us now come to the second part of the talk: hearing loss, which is a very important part of our sensory system. Now, some simple signs which could tell you that you need a hearing test: trouble hearing others in noisy places or in group environments, straining to hear what people have said or asking them to repeat, having to raise the volume of the TV or your phone, things like that are indicators of requirement of an audiogram. Now, an audiometry is done by the audiologist in a soundproof room. And here we do basically test of different frequencies. We give sounds at different frequencies through the headphones and record at what level the person is hearing. Now, in this particular audiogram, which I've shown, you'll see that all the frequencies are almost similar. That means there is almost a 50 to 60% hearing loss in this patient. This is called a flat audiogram. All frequencies similar. And in this kind of an audiogram, typically the person will complain of difficulty in hearing all the time. But I'd like to show you a more common audiogram seen in more early. Now, here it is a sloping audiogram. That means in the low frequencies, what you see on the left side, the hearing is a bit better. But as the frequency increases, just like a slope, the hearing goes down. In these kinds of people, the person will often say that sometimes I hear so well and sometimes I have problems. And the problem is more in group situations and noisy environment. This is called a sloping audiogram. Now, even though the person is saying that I think I hear okay, I don't have a problem, they will have problems because when we speak, the sounds are of different frequencies. Now, just example, suppose I said samosa. The s, the sh, y, all these sounds come at the level of 8,000, right? This 8,000, between 4,000 and 8,000, the nerve perceives these kind of sounds. When I say ma, it is around 4,000, between 3 and 4,000. And our vowels like o, a, e, they are all low frequency. So saying samosa, and if I lose the ma and the sa, you may lose the context of what I'm saying and have to ask me again. So that is the difference of what problems these people will face because they are losing some frequencies. They'll feel that, oh, I hear, but they lose the clarity of speech or meaning of the sentences. A very important thing I'd like to show you again in the same audiogram, which you need to notice, is what we call SDS, that is speech discrimination score. And this shows us the capacity of the hearing nerve to respond to a hearing aid. So if in this particular patient, I were to give a hearing aid, I also have to give the expectation of how much benefit that patient will receive. So here you can see the right side capacity is 65% and the left side is 70%. That means with the hearing aid, this patient would improve by about 65 to 70%. Now, a very important thing to remember, just like all other nerve structures, is use it or lose it. The more you use something, stimulate something, the more active and strong it stays. If I stop stimulating the high frequencies, do not use this area, this will progress. And the speech discrimination score, if it goes below 50, that means I will not get any benefit or very little benefit with a hearing aid. So it's important for us to be able to preserve our hearing and also to stimulate the nerve to maintain a good health of the nerve. So the impact of the hearing loss on our whole system is that because of the difficulty in communication, often they feel isolated, even though they sit in a group, because of the difficulty in understanding, you feel isolated. You don't want to contribute to the discussion. There will be a cognitive decline because when the nerve is not stimulated enough, the affected area of the brain also loses the stimulation, leading to cognitive decline, memory losses, and when you don't understand, it can get irritating or can also start anger issues. So, all of this is really important for the physical health and the mental health of a person to be able to hear well. And there are several studies to show that hearing loss also causes a atrophy, or you can say slowing down of the brain. And it has been shown in literature that a person with hearing loss is 2 to 5 times more likely to develop dementia, and it decreases cognitive function. On the other hand, by improving hearing function, it can even boost your cognitive function by 50% within a year and can reduce dementia symptoms by up to 75%. So we need to be changing the approach to a confused or sort of, you cannot say age, as we were discussing on when we met for dinner for that high tea that day, that age is just a number. And we cannot let age define us. We have to be our best mentally and physically to be able to perform best. And that is why although I don't really need to say this to this group, which is so active, but staying physically and mentally active is the most important way to maintain health. And how we do it, it can be done in different ways, whatever best suits you. But as important as it is to stay physically active, it is also important to stay mentally active. So thank you so much. And I would be very happy to answer any questions.
मेरा इसमें एक लाइटर वेन में ये कहना है कि इसी प्रयास में हम लोग जिज्ञासा लेक्चर कराते हैं, तो अगर आप नहीं सुनेंगे तो आपकी एजिंग जल्दी होगी, ये मेरा आपको एक वार्निंग है। तो आगे से आप जरूर जिज्ञासा लेक्चर अटेंड करें और इसके लिए टाइम निकालें एंड कीप योर माइंड एक्टिव। थैंक यू वेरी मच डॉक्टर साहब।
Thank you so much.
Narendra, you are giving warning to those who are already listening. You are not giving to those who are not listening.
No, you are. If I take attendance of your own presence, you will probably be absent at least 60% of the time.
No, not at all.
I have got the attendance. But you are otherwise